The Aseki Health Centre in the Nanima-Kariba rural LLG of Menyamya district, Morobe province, serves over 25,000 people, including those from the nearby Watut rural LLG of Bulolo district. In spite of that, the health facility has been neglected for over 20 years with no running water, no electricity, leaky roofs, rusty medical equipment, only one delivery bed, and no security for both staff and patients. Officer in charge of the Aseki Health Centre, Sister Matilda Maborai, described their issues as 10 out of 10 until Digicel Morobe staff stepped in to install a solar water pump at a value of 20,000 kina. The project was officially opened and handed over by Digicel Morobe's General Manager, Shona Imatana, on Saturday, 19th of August. Community health worker Elizabeth Awatua, who is from Gulf Province, has worked at the health center for 11 years now. Standing in a narrow room with the only delivery bed in the middle, Awatua said they perform operations and deliveries in their obstetric and delivery room without water or electricity.
And my co-worker, me to plus go kulapi warakam, LP molo waswas, even though late people LP molo walk about we go waswas or so. That's how me plus I live with this difficulty. But now, yeah, and me feeling most and everything is okay because I mean not everything, but for water now I'm relieving me with my co-worker because life here eating in dirty hub. Me to plus I work some time. We go off with dirty hands. Na me to play mama so me tax go handle them all beginning or whatever. But now we're making possible me to play wash him hand. At least I'm relieving me to play now with water supply. So we are grateful very much.
Pauline Gaigami, who hails from Finchafen district, has been working as a community health worker at the health center for 7 years. She works in the labor room with Awatua and outlined that the nearest source of water is 20 to 30 minutes away. Most times, after delivering their babies, the mothers who are covered in blood wrap themselves in laps or towels and make the long walk to the creek or river. When the community health workers face an issue, such as a retained placenta, where a piece of placenta is still left in the womb after delivery, they would start calling for help.
So, all get a time me to plus I carry water lo bucket, come all mama blomila deliver, all retain, all placenta retain and mitla sad one me, all mall, talking more sample was mama, please help me pla lo water bucket lo. House do walkman no got go panim lo creek, no got go lo big lo water. Look out him of them. Smell lo one of something duty blo mitla lo walk. So mitla sa. Manage him go complete. How mitla rausi mama go complete him alright or carry wara bucket go na. Me to play it but go carry wara again lo tank or creek or one map come. Floor must clean, ogata instrument clean.
The project was initiated by 8 female staff of Digicel Lay who applied for the Digicel Foundation 3L staff grant. The grant was 10,000 kina while the staff raised another 10,000 kina to successfully complete the water supply project. Apart from that, 1,800 kina worth of clothing, cleaning agents, sanitizers, and food were donated to the health center as well. Frida Kana, TVWAN News.